From downtown Scranton, this is Northeast Current. WQPX invites you to join us as we explore public affairs, current events, and arts and culture in northeastern and central Pennsylvania. Now, let's meet today's guests on Northeast Current.
Good morning. I'm Cathy Rist Strauch, your guest host today for Northeast Current. And with me is Dr. Linda Thomas-Hemak of the Wright Center for Graduate Medical Education. Dr. Thomas-Hemak, please tell me, what is the Wright Center? Tell me about that first.
So the Wright Center for Graduate Medical Education is a community asset. Mm-hmm. It is a not-for-profit corporation that's been in Scranton, Pennsylvania for the past 35 years. And it's an organization that formed in order to replenish the physician manpower and to really leverage renewal of the medical profession through the professional renewal of helping to make doctors.
Helping to make doctors. Now that's a big thing for me, because I was telling Dr. Linda before about how my daughter wants to be a surgeon, actually, and she's in school, so she'll be headed this way maybe. So it's very important to know all these things, not just for me, but for everyone. So given all that, you deal with the med students when they're in their residency, right?
Yes.
Given all that, I guess our big topic, our big thing that everyone's talking about is Obamacare. And you happen to know things about this. So knowing what's going on with Obamacare, what changes do you see happening with health?
So, you know, I see healthcare as a really bright part of northeastern Pennsylvania's future economy. And I think that it's really important that we recognize that northeastern Pennsylvania has an enormous opportunity for a knowledge-based economy, and that we've been really given a precious new community asset with the Commonwealth Medical College. Mm-hmm. And from the Wright Center's perspective, we're really excited about that because, you know, we've trained doctors for 35 years. We have provided probably more than 150 doctors in the region who are currently still in active practice. And we're really excited about the Commonwealth Medical College's, you know, birth here in northeastern Pennsylvania, so that we can begin to even home grow our own doctors, like your daughter.
Yes, like my daughter.
And so that's very exciting. Everything is changing in healthcare. I think it's really important that, you know, the public be educated about what's changing so that they can really be engaged in the change and bring some constructive consumerism to that change. I think that the change gets sensationalized, and now it's really caught up in a very intense election and has an overtone of a little sensationalized name like Obamacare. And so I'm excited to be here today to just kind of talk about how important healthcare reform is and how change was really so necessary, and that what's driving the change is really just not a governmental need to get involved in healthcare. What's driving the change is that we are putting an enormous amount of resources into healthcare. And I think at the opposite end of what's coming out, it's not 100% satisfaction with great health outcomes. And so I think that change is really being inspired because of a global acknowledgement, you know, some dissatisfied consumers and a lack of national health, and you know, upset and frustrated doctors, and the government saying, wow, that's a big industry, and, you know, the outcomes aren't that great for capitalized America. And so how can we all come together and collaboratively drive change that makes it better and more effective and leaner, so that the public is happier, the doctors have better life-work balance and are better role models of health, I think, and the government can step back and say, you know what, we want to fuel and catalyze change, but that profession and the public, they got a swing going where it's regulated and the outcomes are getting better. And so they kind of allow it to continue to evolve as a capitalistic market, which makes it so wonderful to live in America.
Yeah.
Right?
So given what you're saying, we don't have to worry about the government actually taking over healthcare. The physicians are still going to basically be in control of what's happening with their patients.
I think that the American government right now is kind of saying, hold up, let's regroup, let's give the profession an opportunity to lead. Let's really look at the way that we're mal-incentivizing, maybe with different payments, illness and reaction rather than strategic promotion of wellness. And I think that they are really trying to empower consumers and the public to get involved in that change. And I think it's a really exciting time, because with the government wanting to play an enabling role and the profession rising up to kind of lead the change with delivery system, changing the way that we deliver care and also changing the way that we train doctors who are going to lead the change. And I think the public's deep desire to get healthier, I think it's just, it's an exciting time, and I think it's kind of, from my perspective as a primary care doctor in America, it's kind of sad when that exciting time gets black clouded and overtoned by fear, you know, of change.
Yeah. Okay, now I'm, let's say I'm someone that doesn't make much money, I don't work for a company that offers health care, haven't really afforded it. What do I do right now? Like there's clinics out there, you're saying, that I could go to and
I
get
think
taken care of?
That's a really important point. I think it's really important that everybody globally understand that what we're looking for is high performance. And if you look at high performance in healthcare, it depends on two things. One is that we embrace the internet revolution and the power of health information technology to get wired and connected in communities. And the other one is that we open up access so that regardless of your insurance status, you are able to access what you need in a venue that provides, you know, that provides safe and high quality care. So a lot of what's going on in northeastern Pennsylvania, being inspired by the Affordable Care Act, is that those clinics are getting organized, and they're called the safety net. We're proud as the Wright Center for Graduate Medical Education to really be connected and a part of that safety net system. We're a non-discriminatory provider, so we take all comers. You know,
if I didn't have any insurance, I could go to the Wright Center?
Yes, and you will get treated no differently, because we deliver health care based on evidence-based guidelines that are called planned care at every visit. And planned care is wired in an electronic medical record and in team behavior and the policies of our clinics, and it doesn't change based on the insurance status of a patient. So yes.
And where is that Wright Center again?
So we have 3 centers: Wright Center for Primary Care. We have the Wright Center for Primary Care here in Scranton, which is probably just a little younger than the residency program itself. It's a collaboration with one of our local hospital systems, and that's on Madison Avenue. And
whereabouts? Madison?
Madison and I want to say Madison and Pine. It's Madison and Pine.
That's not too far from the regional center, right?
That's right, near the regional
hospital
center, yep.
Okay.
And then we also have a pretty significant flourishing primary care center in the Mid-Valley in Archibald, Pennsylvania.
Okay.
And so that's about 10 to 15 minutes north of here. That is a really increasing Wright Center for Primary Care clinic. We train interprofessional workforce there, so we train students and residents and learners there from 11 of our regional academic universities. We have significant partnerships going on with the local universities and the pharmacy schools and the physician assistant and medical assistant and allied health professional schools. And it's a very large clinic. We just opened it, and actually there's a grand opening tonight, which is exciting.
Well, not when this is being aired, unfortunately.
Oh, right, right. But the day that
what
we're meeting.
Happened.
Right. So we're opening a brand new medical home clinical showcase in Archibald, Pennsylvania on October 5th. Tonight is our celebration of our grand opening. We actually started delivering services there on September 10th, and we've always had a practice there for the past 15 years. And the third one is in Clark Summit. So we have a new Wright Center.
Summit, I probably passed by there. Is it on the main road?
It's right on the main road, right near where Brown's Gym and that whole shopping center is. And we have a Wright Center for Primary Care there that actually has 2 physician leaders who are our graduates, and they are locally grown home docs. And so we're proud of them, Dr. Leo and Dr. Baruti up there in Clark Summit.
Nice, nice. We're going to take a short break, and Northeast Current will return with Dr. Linda Thomas-Hemak.